Hi everyone, welcome to Be Live. This is our August edition, and we're joined by the lovely Debbie, who is a psychotherapist, and we're going to be talking about all things mental health, mental health during lockdown, and all those interesting things. So thank you very much for joining us, Debbie. Can you just tell us a bit about yourself, how you got into psychotherapy?
Thank you, Gloria. So yeah, as Gloria mentioned, my name is Debbie. So I am a psychotherapist. So I work for for the NHS as a CBT therapist. So in terms of how I got into psychotherapy, I did psychology and sociology for my degree, for my undergraduate. And you know, when you do psychology, there's no one that tells you that you're not going to get a job straight away. So when you do psychology, so I ended up taking a year out and just doing voluntary work. So I started off working with ex-offenders, tried to help them integrate back into society. So working with their probation officer, looking at their housing, doing their CVs and things like that. And from that, I worked with a lot of young Black men, and I was quite passionate about then getting into, basically, because you would see the impact that it would have on their mental health. So from that, I just decided that's exactly what I wanted to do, because even though I did psychology, I wasn't so sure which branch I wanted to take. So by doing that, I recognized that, yeah, that's exactly what I wanted to do, because I wanted to help the community, people who look like me, who are marginalized and don't get the right support. So I wanted to be a part of that. So that's how I got into psychotherapy, really.
Oh, fantastic. And let's just go straight into it. When we're talking about mental health in the BAME community, a lot of the themes that come up quite often are things like, stigmatization, and things like that. So I'd like to know, why do you think that, it's so heavily stigmatized in the BAME community when talking about mental health?
I think that there's so many factors that add to this conversation. And I think obviously we don't have a lot of time to kind of go through most of them, but I think one of the major reasons is cultural beliefs. So cultural beliefs is one of the things that that is so heavy within the BAME community, that basically deters people from seeking help. Because if you think about maybe how in severe cases, where someone's probably going through, whether it's schizophrenia or bipolar or things like that. So in those severe cases, and then you hear people mention it as that person's crazy, so quote unquote crazy. So there are these cultural like stigmas or beliefs that sometimes different cultures, different cultures have, that deter people from actually seeking help. And I think also the whole issue of lack of knowledge as well, in terms of what mental health is and what mental health difficulties are. And so when there's a lack of knowledge, it means that people are not going to even give a chance to have a conversation about it, to try and break any stigma that there is. And I think also in most cases, especially within what you'll find is within the Asian culture, they value even within the African culture and Caribbean culture, they value the family aspect of it. So you don't want to dishonor the family's name, so there's that barrier as well, that stigmatization of you're going to bring shame to the family's name. So whatever is happening, we keep it in-house, and don't talk about it. But then the difficulty with that is because you don't seek the right support in the family, no one's talking about it anyway. So there's nowhere for you to basically, feel free to discuss anything that you might be struggling with. So that's one of the things. And I think also the other thing is kind of like the men's concept of like masculinity as well. So if it's basically a man should be strong, a man should not be, should be handling, you shouldn't show any signs of weakness. And I think that also I think is just overall in general, but you see it so much within BAME communities. But I think it's also in just generally in society, in terms of men being strong and being able to handle things. But I think if for example, if you look at the African culture and what a man is supposed to be, they're really brought up, and, you know, it's very instilled in them to be strong and not to be broken by anything. And if you're going through something, you know, not to basically show any emotion, which is difficult. So I think that's just I think that those are just some of the reasons, just small reasons as to why people maybe find it so hard to seek help because of stigma around mental health.
No, definitely. I do definitely agree. When you were talking about the cultural aspect, I know in the African community, a lot of people believe that if you've got a roof over your head, you've got food in your stomach, you've got a job, what else are you complaining about? What else is there, you know, what else is there to struggle? And I feel like a lot of people, even back home, when people talk about them, you know, their issues with mental health, people say, well, that's an English thing, or, you know, that's something that doesn't happen here. You know, we have many other issues, but mental health shouldn't be there. I mean, you're living in the UK. What are you struggling about? You know, you've got a job, you've got a roof over your head, you know, you've got food in your belly. Like, what else is there to worry about? And I mean, linking this with HIV, I mean, we look at the stigma around HIV when we talk about it. I know in a lot of circles, when I begin to talk about HIV, people are just, they shy
uncomfortable
away.
Right?
They get really uncomfortable. And I think it's for the fact that it's a sexually transmitted, you know, a lot of the times it's transmitted sexually. So people are often shy about, you know, why are we talking about sex in our homes? And, you know, the awareness is not out there. That's why I feel like it's really important, the work we do at Positive East. I mean, right now we're running, we do HIV awareness training. So I train different organizations, you know, different groups in the community, and I talk to them about, you know, HIV in 2020. Because a lot of the time as well, people still have the mentality of you know, when the AIDS pandemic came out in the 80s, and people still remember that. People don't realize, you know, things like you equals you know, that you can live a long and healthy life.
And you can live a healthy life. You know, if you've got the right support, you can absolutely live a healthy life. And I think just you saying that is the same thing with mental health. Just because you have mental health doesn't necessarily mean that it's you're doomed. With the right support, you can get treatment and you can get support and you can live a life that is in abundance. You know, just that's not going to be the end of the case for you.
100%. I think people, when they hear the word mental health, it's an automatic assumption that, you know, it's either or. There's no people, they don't believe that people can live, you know, a healthy life, you know, with a mental health condition, which is the kind of things that's why these conversations are really important, just to break down that stigma, you know, and make sure people can, you know, with things like counseling, with medication, you can still live, you know, a normal and healthy life.
And so I think also, sorry, go on.
No, sorry, go on, you go on.
Now, I was going to say, like, the fact that the lack of awareness and poor awareness in terms of like the topic of mental health as well. Like you said before, in most cultures, we don't hear the word mental health, period. You know, we hear physical health and we prioritize physical health, but we don't basically include mental health in the health aspect of it. So I think the lack of just awareness and knowledge. So even things like there's a difference between depression and anxiety. You know, these are words that are not in the vocabulary of most BAME communities. You know, depression and anxiety is, to be fair, it is a Western, it is a Western definition. So we don't hear it as much. So I think a lot of awareness and education and these conversations, like you mentioned, just need to be happening so that we can even know the difference between, because even though there's depression, there's mild depression, there's severe depression, there's, you know, there's SAD, which is seasonal affective disorder. So there's different things about it, and just educating ourselves about the different types of problems that are under the umbrella of mental health will kind of free us a lot, because I think that people, when they hear mental health, is basically under the word crazy or you've completely lost your mind, which I don't think is really the case. We know that it's not the case.
No, definitely. That's so true. And I think the more we open up and the more we have conversations about it, we realize we're not alone. There's probably a lot of people who are, you know, have varying degrees of mental health conditions or mental health issues that are functioning very well. So
absolutely.
Yeah, I totally agree with that. So moving on, how do you feel that lockdown has affected people's mental health?
I guess because of the one, everything was just completely shut down, right? There's a lot of things. So for people who maintain their mental health based on their activities, their routine, and their routine being completely disrupted, that can heighten or can cause people's mental health to deteriorate. The financial, blow to people's families who probably who are self-employed, who are in businesses, and they don't really have a they don't really know what they're going to do financially. So the stress of the financials also can impact on people's mental health, and even the lack of support during that time, because there are people who, for example, single mothers, single parents, who do depend on family members to help them with their children or things like that. So not having that support, and you might find that you're a single parent, you need to work at the same time from home, you need to parent your child, you need to do homeschooling and all those kind of things. So that as well, without having the support, definitely would have impacted people's mental health. And I think also problems with housing, because everything kind of stopped. So if there was a matter that was being dealt with, whether it's home office, whether it's doctor's appointments, whether it's physiotherapy, all these things that kind of stopped, and it meant that so many people maybe didn't have the support. That support was taken away from them, and that definitely would have impacted people's mental health, definitely. And the isolation, because some people live by themselves.
No, that's so true. I mean, we carried out a study amongst our service users, and the statistics spoke very loudly. I mean, it was a small study amongst the service users that access our services, and we found that half of them reported feeling more isolated due to COVID-19. Obviously, because of all the points that you've mentioned.
Yeah.
6 out of 10 of them, reported that COVID-19 has impacted their health and well-being.
Yeah.
So probably they're not able to, as you said, get out as much as they used to. Nowadays, obviously, lockdown is slowly easing, but in the middle of it, we were allowed out for 30 minutes. And if you're used to running outside, and you're quite active in the community, that's going to be something that's going to be hard to take. Yeah. And it also affected our service users in other ways, because just under half of them felt that it put a strain on their finances. Yeah. You've got people who work 0-hour contracts.
Exactly.
You don't have that support right now.
You don't have that support, and also the fact that financial burden, because the thing is I think what we don't realize is a family who lives in under one roof, and the kids are going to school, you're going to work, your partner's going to work, if it's a whole family unit, and now everyone is at home. Remember, your expenses are going to increase because everyone is at home. You've got to feed people, there's the utility bills are going up, but maybe it's like your outcomes have increased but your income has not. So there's a financial, so you find people reporting about worry and all that. And I think even for people who have long-term health conditions as well, they reported having worries about either them or their family because of catching the virus. So a lot of people, we found that worry was one of the things that kind of people were referring to, and OCD as well, because at that point, people who have fears of contamination or catching something, they were triggered at the same time. So we saw a rise in that. I think the other thing that was a rise is domestic violence. So there was a rise in that, which then obviously impacts people's mental health, because you're in an environment where emotionally, physically, or psychologically you're being abused, and you feel like there's no way out. So that as well was an issue, has been an issue, really.
It's impacted people in a lot of ways. I think also when we were discussing the way people grieve, in the African community, when somebody passes away, it's just our normal culture to go and console that person. We'll go and sit in that person's house, we'll do a food shop for them, we'll sit with them until the funeral, and then after that we still pop in and see how that person is. I had a friend who lost their father, and it was so difficult because we couldn't sit with her.
Yeah,
We couldn't,
couldn't do
you
it.
know, we couldn't visit her. So in the long
Couldn't
term,
go
I
to the
think,
funeral to support them, you know.
yeah, in the long term, off the back of this, it's scary because you think, what are people's mental health going to, what is their mental health going to be like in the future? Because
Yeah,
it's not just a short term thing. I think all of us, initially when we went into lockdown, I thought, oh, 30, 30 days or 3 weeks or whatever, then it's all going to go back to normal. But
yeah.
it hasn't been like that. So I think in the long term, we need to look at the way we're supporting people.
Absolutely. And
You know,
the knock-on effects of it, because financially we can see like the whole country is in a financial state at the moment, you know, poor financial state at the moment. So we also have to factor in how are these things going to how they're going to affect, because if you look at the BME community, there's a social and a financial inequality anyway. There's a gap, so they fare less than their counterparts, which the white people, individuals. So it's they kind of fare less when it comes to the social aspect, so with the housing, financials, opportunities and things like that. So we also have to think about, already there's a gap, and then there's a blow in the economy at the moment. So how is this going to affect so many of the individuals from the BAME community?
No, definitely. It's a really interesting conversation that we need to continue having. But another question I had was, I've noticed when we're looking at statistics about the BAME community and accessing mental health services, I see that they often access it quite late. They often access it at a later stage than probably their white counterparts. So what do you think that is? Why do you think that happens?
I think it goes back, an element of it goes back to what we were talking about in terms of stigma. So when there's stigma, and then when someone is feeling anxious or worried, or even feeling shame, right, they would be reluctant to seek that support. So I think stigma is one of them. The other one is financial factors as well, because financial factors, it means that for me to be able to receive, because especially if you're receiving help from a public sector, so if you're receiving help from NHS, because of the demand for the service, it means that they can't be as flexible as we would like them to be, because there's such a huge weight. So what happens is you find that sometimes the weight in itself can get, if there's no great communication between the service and the individual to basically say, this is how long, this is the process. Where there's lack of communication, it means that the person just kind of gives up, and they're just like, oh, and that means that it takes a while before, and unfortunately gets to a point where it gets severe. And that's when people start to seek for help, when it's severe. So a lot of the times we see that, especially with Black men, they're more likely to engage in mental health services through the criminal justice system. They're overrepresented within the mental health institute. And I think that a part of it is because we wait for so long until it's severe. And then we find that, they're overrepresented. But then the other thing as well is the lack of maybe healthcare professionals in understanding the symptoms that are being communicated. So if there's a language barrier, for example, if someone's saying, I'm having headaches, I'm finding it hard to sleep, but they can't communicate that they're feeling low, because remember what we talked about in our culture, or in most cultures, in BME cultures, they don't say that I'm feeling low. We don't say I'm feeling depressed. We don't say I'm feeling anxious. So when you communicate specific symptoms, the GPs can, their way of interpreting the symptoms is way off, and there's research that has shown that GPs are more likely to prescribe antidepressants to people from BAME communities than the white counterparts. So there's also a need to kind of have training and have conversations with healthcare professionals to basically help them figure out what are the things that you find difficult when it comes to communicating, or when it comes to understanding symptoms from the BAME community, individuals from the BAME community. So I think that also means that people access the service late, because if the GP is not picking up on those symptoms quite earlier on, because if it's headache and lack of sleep and you think, okay, maybe this person just needs like sleeping tablets or something like that, but not really having time. And I think also time for the GPs, because they don't have a lot of time. They have to see so many people in so little time. So they don't have that time maybe with individuals. And if you're working with an interpreter as well, I mean, 10 minutes, 15 minutes is not enough to fully get the scope of what that person is going through. So I think that also adds to the whole point of people accessing service late. And just the recognition of mental health difficulties, you know, the fact that sometimes if we're not educated enough to understand what those are, we won't be able to seek support. You know, we will basically keep going and not recognizing that there is an issue. It's basically like physical health. If you notice something and, you know, you keep an eye on it for some time and you realize this thing is not going away, if you don't go to have it checked, by waiting for so long, basically what you're doing is it's basically going to get worse. So by the time you go to the doctors, it's basically at a point where maybe it's really severe, and what could have been done, early intervention would have been really helpful to prevent that person getting to that stage. So I think that also is a part of the reason why people don't seek help, because again, they just don't have the awareness of the mental health difficulties that they may be facing.
No, definitely. I mean, I saw a lot of similarities in what you just said and the work we're doing with people living with HIV. I mean, in the Black community, late diagnosis is a big problem, especially amongst the African men. And I mean, I read a report and it was saying that, you know, as you know, as the BAME community and as Black people, you often have a lot of other pressing matters. People, you're worried about sending money back home. You're worried about working. You're worried about your immigration status, your health. It's often, it takes a back burner. So, I mean, somebody could be living with HIV for a long period of time, but because they haven't seen a GP, or they haven't thought, let me just test myself routinely, it hasn't been picked up. And I mean, that's why it's really important. And we advocate, at Positive Ease to test regularly. I mean, recently we've launched a new online testing system. So we're not testing face-to-face as per se, but we are supporting people doing testing via Teams. So I mean, if they go on our website, they can contact us that way, or we can call them back, and we can support them in ordering a test at home, and we can support them with doing the test via Teams. I mean, we need to make sure that our health, is at the forefront of our lives, because health is wealth.
But when you think about it as well, like Gloria, like when the law changed, and it was basically, if you go to the hospital, they would ask you for your status and all that kind of stuff. So that, especially in the work that you do, I can imagine the impact that it had in that area, because for someone who is worried because they don't have their status completely sorted out, that also will deter someone to go and seek support when they actually need it, because they're worried of the consequences. Like you said, they have so many things that they have to worry about, that their health is not really paramount to them. And I think that that's so true in terms of what we're saying, because even when I work with people in therapy sessions, what I find is, life gets ahead of them, and they try and they stop the things that would help maintain their health, whether that's psychologically or physically. They stop those things because they don't deem them as priority. And then they're kind of chasing to kind of deal with what, the matters or the problems of life, the matters of life that they're facing, and not realizing that actually, if I meditate for 10 minutes, if I make sure that I am working out for 10 to 20 minutes, however long. So those things, if I make sure that I'm connecting with friends and just having a chat or two with a friend, those things are really important to keep you going. But those are the things that people let go of.
Definitely.
Because of the circumstances.
Yeah, it definitely gets put on a back burner. But I mean, when it comes to definitely mental health and HIV, early diagnosis is key. So the earlier somebody is diagnosed, the more likely they are to live, you know, a long and fruitful life, you know, without, you know, a lot of issues. As we said previously, living with a mental health condition is very possible. You can live you know, a very happy life as long as, you know, it's maintained, you're taking care of yourself, you're looking out for triggers, you're noticing when maybe you're getting, you know, you're feeling a bit more down than usual, and you're getting early intervention. So the same with HIV, early intervention is key, and that's why it's important for us to continue having these conversations. I mean, another thing I'd like to discuss is faith and mental health. I mean, you know, in the BAME community, it's no secret that, you know, faith is a big deal to us, and it's at the center of our communities. I mean, a lot of us, or a lot of our parents, for example, when they've come to the UK, they found support from the local, you know, from whether it be the mosque or whether it be the church. That's where they've, you know, it's like the local hub. It's where you know, meet people, you make friends. It's where you go.
People like you, isn't it?
Yeah, no, definitely. So what role do you feel like faith has to play within mental health, or can they work together? Because I know some people say that, I often hear things like, well, you can't have a counselor and go to church. You know, those are the kind of things.
You know me already, Gloria. I am passionate about this, and I challenge, like, this is one of my areas where I'm like, because churches or mosques or temples, just places of faith, right? They have such a deep connection with the community. So they have to take an active role to be able to bridge the gap between organizations, the local organizations or services, and their individual, you know, congregation, you know, to be able to support their congregation fully. Because one of the things that I can't stand, and this is something that I'm so passionate about, is that, you know what, if you're going through something mentally, then it means that you're spiritually weak. It means that you've done something wrong, and, you know, the universe or the devil or Satan or whoever he is, he's trying to attack you, and you're being punished for something that you did wrong, and all these things. And you know what, I just, those are the beliefs that I can't stand when it comes to it. Because at the end of the day, I always say, listen, God is the creator of all, right? And just like we have doctors, right? If you're going through something physically, you can have faith, but your faith has to come with action. Does that make sense? So you have to have action. So God, you places resources on this earth to help us, you know? So it's not a case of if I'm ill and I don't go to the doctors, I'm lacking faith. Or if I'm ill and if I do go seek help and support for my mental health, then I am lacking faith. I'm so passionate about this. Like, I'm really passionate about this because it really gets to me. And I think that churches should, and mosques and and temples and all places of faith should prioritize talking about mental health in their respective places of worship. They need to prioritize it, because if we're going to break the stigma that we're talking about, they have such a huge part to play in it. They have to first educate themselves, or ask people within the local services to come in, sit down with the leaders of the place of worship, speak to them, talk to them about, get them to like know more about mental health, because the more they know, the more they can support the people that is around them. And what we found is, especially where I'm working, because I'm the lead of the BME, like working with the BME service users and trying to increase access for service for BME individuals. So one of the things that we're kind of doing is working with the local organizations. So if it's charities, if it's like faith-based organizations, so working with them, because what we find is if the individual is reluctant to seek any sort of support because they trust their leader or the person who is in their who is basically in their church or their mosque or their temple, because there's a trust level there, rather than me approaching you, I can, your person or whoever the leader is can have a conversation and say, okay, this is what we can do. And they can bridge that gap. So they have such a huge role to play in this. Like, I'm really passionate about this.
No, we definitely agree, because I mean, it's funny how a lot of the work that we're doing and a lot of similarities we're seeing, you know, that they're both within HIV awareness and mental health. I mean, when it comes to HIV awareness, we also work quite closely with faith groups. I mean, we run a yearly faith symposium, so that's where we have pastors and imams and, you know, different people, different faith leaders, and we come and we sit together and we have a conversation and we talk about, you know, HIV awareness in our respective communities, how we can continue HIV awareness, how we can talk about it, approach it, you know, correctly. As you said, it's important to hear somebody, because it's going to be difficult for me going to a community that I'm not a part of and trying to say something to them. Whereas if there's somebody from that community who is, sorry guys, sorry, sorry Debbie.
All right.
It's important for somebody from that community to be able to have those conversations.
Yeah.
So if, as we say, knowledge is power.
Yeah.
So if we can give those communities the knowledge they need to continue that, you know, giving that awareness in the communities, it's perfect. I mean, my colleague Badru is currently working on a project with imams. So he goes around and speaks to imams, and he has he's creating material for them, which is quite interesting. Sorry, Debbie, 1 minute. Sorry, Debbie.
It's all right.
Yeah, so he's creating material for the Islamic community. So he has really important conversations with the imams and things like that. So as you said, I totally agree. I feel like it's about it's finding that line between not imposing, you know, going into a community imposing, but equipping that community with the knowledge. So with HIV awareness, you know, as I mentioned before, the training that we offer. So we offer different communities training and make sure that they're able to have those discussions within their own communities. So I think that's fantastic. So if somebody was saying that, you know, I've been feeling low, I've been feeling down and something like that, what would you recommend them doing, or what kind of ways would you recommend somebody dealing with any potential mental health issues that they're having, or if they're just feeling down? Because as you said, a lot of time people wouldn't identify exclusively as, okay, I'm feeling sad, I can't sleep, I've got a mental health issue. So what would you say to somebody who's probably experiencing those things? How would you suggest that they address that?
So one of the things is basically making sure that you're basically keeping an awareness, or if I say that, like keeping tab on basically how you're feeling, how long you've been feeling like this, you know, what are the physical symptoms that you're getting, how long has it, basically in the same light that if you had a physical condition, that you would monitor it. And then when something happens, you know, when you think, okay, this has been going on for some time, I really need to speak to someone about this. One thing that I say is don't Google, because if you Google, it's going to tell you that you have the most craziest thing ever, like, and it's not the case. So all I say is, you know, speak to someone who is knowledgeable about it. You know, if you have friends and family who you know that have gone through maybe similar situations, speak to them if you feel comfortable to speak to them. If you have access to, for example, every single borough or borough has what we call an IAP service. So it's basically a talking therapy service. And you can definitely, and it's free, you don't have to pay for this, you know, it's a part of the NHS. In every single local borough, every single borough, there's one there. So please identify what is the talking therapy within my borough and call them and say, make a referral. The good thing about now is most of these services, talking therapy services, have a self-referral system. So you don't even need to go to your GP. You know, you don't need to go to your GP to say, this is how I'm feeling. If you feel like you want to go to your GP and talk about it, that's absolutely fine. making sure that you communicate that very well, because like I said before, sometimes it can be there can be lost in translation, like whatever is communicated. So that's absolutely important. If you can't, then go to do a self-referral. When you do a self-referral, someone will contact you. And then the other thing is always ask for information. If you're not sure about anything, please ask, because what I do find is when there's that lack of understanding, which it can be from the professional side, the practitioner side, where they don't maybe communicate the process quite clearly, and then the person gets lost, and then they just kind of give up, and they don't push it, or they don't do any, they don't ask for more to be able to understand it a little bit better. So if you don't understand something, ask, always ask.
No, definitely. I mean, during this lockdown period, we've also been unable to meet with our service users face to face. So I mean, right now we've got a staying home. We've got a series called Staying Home. So we've got a series of different topics, different chats. So this is just one of them. I mean, also we offer free counselling for people living with HIV. So if somebody is living in East London or accessing the health service in East London, they can contact us and they can have access to free counselling. We also, before we used to have holistic therapies, so we'd do things like massages and things like that. But obviously things have changed. We're living in a new normal. And we still have things like support groups via Zoom. So we've got dancing sessions and things like that. And sometimes it may not be the fact of physically being with somebody, but just that even if it's seeing somebody on Zoom for 10 minutes, dancing. We all know that exercise is fantastic for people.
Absolutely. Exercise is so important. But the thing is I feel like even within the BAME community, we don't talk about exercise and we don't prioritize exercise either. So exercise is basically, now there's more of a push, so things like diabetes and all those things are very high in BAME community. So understanding our diet, understanding what we're eating, understanding all this is a part of not just your physical health, but also your mental health at the same time. Because what I say to people is, if your physical health is impacted, that will automatically affect your psychological and your emotional state. But if your emotional state is impacted, basically either one of them is impacted on, it's going to affect the rest of them. So they're all connected, emotional, physical, and psychological, they're all connected. So you have to take care of all of them. You can't neglect one, because if you neglect one, the work that you're doing may be void to some extent, because it's not really helping all the other areas.
Exactly. And I think a lot of times, like, for example, I've heard of people who they attend GP and say, I'm feeling this and this and that. And as you said, the GP, the first thing they'll do is prescribe antidepressants.
Yeah.
And that's not the case. But it's not going to, obviously it'll work for some people, but obviously there's other ways of, helping with your mental health.
Yeah.
So as you said, I think it's very important that we advocate for ourselves.
Yeah, and we do that by basically educating ourselves more and more and more. So it's so important to educate ourselves more and more and more. But also, I also recognize that services also have to have a cultural awareness, appropriation at the same time, because one of the things that I am very passionate about is if someone comes through our service, or someone comes through and they can't speak English and they need an interpreter, sometimes because of the challenges of working with an interpreter, you don't want to just say someone, oh, they're not suitable for the service because they're more complex. No, they're not complex. They're presenting with depression, just like any other person who would be speaking English is presenting with depression. Yes, it might mean that you need to adapt therapy, but that's what we need to do. It doesn't necessarily mean that the person is not suitable for the service. They're clearly suitable for the service. They're not severe that we need to kind of refer them to secondary care. So those are the things for me that I'm really passionate about. And I'm like, okay, from a professional perspective, a practitioner perspective, how I can make a difference within the place that I'm at, to raise certain things and challenge certain things.
No, definitely. I think also we need to work on things like the secrecy, of having a mental health issue, or, struggling with your mental health. We're human. You
Yeah.
wouldn't judge somebody who broke a leg or who had cancer or, you know, something like that. So why would we feel like we need to judge, people with mental health issues? I remember when I was feeling really down and I got diagnosed with depression, I found it so difficult to talk about. I couldn't tell anybody, but I feel like working alongside organizations like Insight helped me find that voice and feel more confident with, owning it and saying, this is me. And that's why I say it's, I mean, I've mentioned Insight, and that's an organization that Debbie runs, and it's fantastic, and I can't sing their praises more than enough. But it's a great thing. If you'd like to tell people a bit more about Insight, the work that you do, and things like that.
So thank you, Gloria. Gloria's worked with us. So Insight, it's Insight.aie, which is AIE is basically awareness, inspire, and empower. And basically it's in the name. Our purpose is basically in the name. What we want to do is bring awareness to mental health difficulties within, BME communities, to be able to inspire people to make a change so that they can be empowered in their lives. So that's basically in a nutshell what we do. And we do have social media platforms where we use these means as a means to kind of break that stigma and break down that stigma and just talk about things. Sometimes what we do is we find that I might post something and then we'll get someone message us back, and they were like, I didn't even know this was a thing. I just thought that this was normal. I was going crazy or something. I didn't even think that this had a name, So that's basically what we're trying to do. We're trying to break those stigmas or even lack of understanding or education or knowledge on what type of mental health difficulties are there. So we work with churches a lot of the time. Being a Christian, I work a lot with churches, going around churches to basically raise awareness about mental health issues. And then also we're working with organizations, so delivering mental health workshops to different corporate organizations, and also offering therapy as well. So that's one of the things that we do, because what we realize as well is sometimes people may not access services as well because they don't have they're not represented within those services, So if you're looking for an Asian therapist, if you're looking for a Black therapist, am I going to get that? And sometimes because there's a lack of that, or there's a limited number of those, it means that certain people feel like they don't get their needs met. So that's basically what we do. So I'm one of the half. So there's two of us that we do this work together. So Susie, I do this work with Susie, but
Fantastic. And I do believe we had one question. I think somebody asked if HIV treatment is free in the UK. And yes, HIV treatment is totally free for everybody in the UK, regardless of immigration status, regardless of anything. If you're here and you need treatment, it's available. So don't feel like you can't access treatment because you're worried about the cost implications. It's free. It's totally, totally free. And I think that's everything. Thank you so much, Debbie, for joining us. It's been fantastic having us.
It's been my pleasure. It's been absolutely my pleasure to come on board and have this conversation, because like I said, this conversation is so necessary. We need to break it down. We need to have it more, especially this season where we're losing people, and so many people have lost people at the same time, and not having that space and safe space to talk about the loss. For example, today, I was really heartbroken to find out about Chadwick Boseman. Like, literally, I was crying because I was just like, I remember when he had one of his pictures up and he had lost so much weight, and people just dragged him on social media, for the weight. And it just goes to show that you have to just be kind to people, because you don't know what someone is going through. You don't know the battle that they're fighting, 100%. And he gave the best that he could in the situation that he was in. And that's just so inspiring.
No, definitely. Sorry, Debbie, I've got one more question.
Yeah.
So what advice would you give someone who has been given antidepressants by their doctor for the first time What questions should they be asking, and where else can they go for help?
So that's a really great question, really good question. So what I would say is you can ask the doctor in terms of like, you know, why am I getting these? Are my symptoms that severe for me to get these? What are the side effects for me taking these antidepressants? Because the thing is even though if it's the first time you're receiving antidepressants and you haven't maybe had any therapy before, I would probably recommend getting some therapy. But in the most severe cases where someone is probably severely, for example, severely depressed, and they can't find themselves even getting out of bed is really difficult, going out, basically the activity level is completely low. So in those cases, what works best is a dose of antidepressant and therapy at the same time. So not, because if you think about it, antidepressants are like basically, it's like a cover up, it's like a plaster to kind of help you kind of, you know, keep going. But in most cases where you have antidepressants and you have therapy, that at the same time is in therapy, you're getting the tools that you can use to kind of help you. But in some cases where people suffer from major depression, they do require to just be on the antidepressants, because the antidepressants just gives them a push, but at the same time, they don't have to heavily depend on them if they have the tools to kind of help them. And that you can get that from therapy. So in terms of where you should go for help, go to your local, like I said, find where your local talking therapy is, and call someone, and you can have this conversation with someone in terms of like, what would I get out of therapy, so that you know what you're going to get out of. But I know that there's some people who feel like, I am not severe for me to have antidepressants. In fact, can I try therapy first? And you can have that conversation with your GP and just say, can I try therapy first? And they are obliged to basically, yes, refer you to talking therapies. They will do that.
Yeah, I mean, also you can get private therapy, but that does vary on cost.
Yeah, that's the other thing. Private therapy is another option, but sometimes that can be costly for some people, and also if they don't have the means in terms of like finances, it makes it quite difficult. But in terms of the NHS, is there. But the only thing that I would say is be prepared to kind of wait, because it is a long wait within the NHS. But in terms of your assessment, just them kind of assessing you from the get-go is not a long, because they will assess you quite quickly. But it's basically receiving the treatment that might take a little bit of a while.
Okay.
I hope I answered that question.
I think you have. But as I mentioned before, if it is somebody who's living with and affected by or who's living with HIV, they can access free counselling. They can access free counselling through us. I think we've got one more question.
I think just to add to that, to what I've said, in cases where someone has maybe schizophrenia or bipolar or those mental health difficulties, then medication is very much recommended. But when it comes to mild to moderate depression and anxiety cases, then you can definitely say that, can I try therapy first before I try the medication?
No, definitely. And there's also another point. I remember when I first presented at the GP with feelings of sadness and, you know, feeling quite low in general, the first point was medication. But I was lucky, I was employed in a place where they gave us free counselling through work. So also people, I mean, sometimes you may not want to have those conversations initially with your employer, but sometimes you have work packages that may offer you free counselling. So, you know, it's worth trying to see if you've got any healthcare plans or anything like that in the workplace.
And also just to add on to what Gloria has said, is sometimes we find that some people are reluctant or they don't go for treatment. So we do the assessment and then it comes to the treatment, and basically because of their work, they can't accommodate, they feel like, I can't accommodate the days for therapy. But your your employment or your employer is meant to support you. You know, they have to support you with whatever challenges that you're having or whatever difficulties that you're having. So one of the things that from our service that we do is we might give, we give the person a letter just to say, yes, this person has been offered therapy sessions. It would be really good if, any support from the employer would be really helpful. And so, yeah. So then at least they, they're cleared for however long that they'll be having their session. So at least the employer can support them.
Oh, fantastic. So thank you so much, Debbie. We've absolutely loved having you on here. Just to finish up, how can people contact you? If people want to know a bit more about Insight.aie, how do they reach you and how do they get in contact with you?
So if you want to send us any maybe questions that you may have regarding therapy or mental health, so our email is info@insight-aie.com. And if you want to find us on Instagram, we're on Instagram as Insight_AIE. On Facebook, we're Insight.aie. So that's how you can find us. So just follow us on Instagram or Facebook, or even just send us an email. And yeah, definitely. So we're working on a website which is coming up soon.
We'll keep our eye out for that, definitely. But also, if you'd like to get in contact with any of us at Positive East, you can contact us through our Facebook page, which is the one I'm hoping you're watching this on now. Or you can contact us through our website, which is positiveeast.org.uk. And as I mentioned on there, we're offering training. So we're offering HIV awareness training. We're also supporting people with testing. We've also got a love chat box on there. So if you've got any sexual health related questions, you can ask us on there and we will try our best to answer. But once again, I'd like to thank you so much, Debbie. It's been fantastic having you here.
Nice. Yeah. Thank you so much for having me, guys. This is good.
Worries. Yeah, definitely. All right, everyone. Take care. Enjoy the rest of your weekend, everyone.
Bye, everyone.